And to put this into some perspective, this is 3 times higher than the city's homicide rate. And it is estimated that 30,000 people are abusing heroin in the city at any given time. Here in Montgomery County, 253 people have overdosed and died this past year, and that's up from 177 in 2015. The state and the county has taken critical steps in addressing the issue. To give a few examples, last month, Governor Tom Wolf requested for $10 million to be set aside in the state's budget to provide local law enforcement across the state with the opioid overdose antidote, Narcan. And County Commissioner Dr. Arkush, who is with us this evening, issued a standing order to allow pharmacies in Montgomery County to provide Narcan at the request of any member of the public. With the leadership of Kay McGowan, who is also with us tonight, Administrator for the Office of Drug and Alcohol Programs, the county has dedicated numerous resources to the issue, in which we will be discussing over the course of the evening. At this time, I would like to thank our event partners: Office of State Representative Matthew Bradford, the Salvation Army, Montgomery County Sheriff's Office, Montgomery County Office of Drug and Alcohol, and the Montgomery County Human Services Center. I would also like to thank our guest panelists, who will be introduced by our moderator. Our panelists come from a wide range of backgrounds, each with a unique experience in addressing the crisis, and we thank each of you. We thank each of you for your dedication and your service to our community and your leadership on this issue. Our moderator for the evening is Paul McConnell. Mr. McConnell was an elected member of the Conshohocken Borough Council and served from 2008 to 2015, and was also the president of the council from 2010 to 2015. He is also a member of the Conshohocken Environmental Advisory Council, a member of the Conshohocken Plymouth White Marsh Rotary Club, and a founder of the Conshohocken Community Garden. During his time as borough president, Mr. McConnell was instrumental in establishing the Narberth Ambulance Station in Conshohocken, which no doubt has saved lives, including those who have overdosed in our community. And please join me in welcoming Paul McConnell.
Thank you, Matt. Thank you for taking the initiative on this important discussion, and thanks each and every one of you for coming tonight. Our agenda tonight is approximately 1 hour and 20 minutes. I'll first introduce our panelists, then we're going to start with a story from Benny Mozakowski, who's right up here, and he's going to speak about his personal story with addiction, treatment, and recovery. Then we're going to have 4 10-minute segments addressing the following subjects: the impact of the current opiate epidemic, how this issue is being addressed legislatively at a local and state level, law enforcement's efforts in combating the epidemic, and prevention and intervention methods. We're going to host one audience question after each segment, but we're going to save 10 minutes or so at the end to host any general audience questions at that point in time. We're going to end the program with a presentation about Narcan. A few simple housekeeping rules, and I just did this. If you could please turn off your cell phone, silence the ringer, is the first one. The second, if you do have any questions or comments, we're asking you to keep them singular and brief so others have an opportunity to ask their questions. And finally, like Matt said, to make you aware, this presentation is streaming live on Facebook. And therefore, if you are going to ask a question or speak, if you could please come to the microphone so the people in Facebook land can hear you. All right? So let me start with introducing our panelists. First, we have Montgomery County Commission Chair Dr. Valerie Arkush, a nationally recognized public health policy expert. She previously was a professor of clinical anesthesiology and clinical obstetrics and gynecology at the Perelman Center of Medicine of the University of Pennsylvania. In January 2015, Dr. Arkush was appointed county commissioner and won election to a full 4-year term the following fall. She now chairs the county commissioners. Dr. Arkush is a graduate of the University of Nebraska College of Medicine and has a master's in public health from Johns Hopkins Bloomberg School of Public Health. And like Matt said, she was instrumental in starting the Narcan program. And sometimes you may hear the word, no, I'm going to say it wrong. Say it. Naloxone. One's a generic, one's a brand. They're interchangeable. They're effectively the same thing. And like Matt said, a standing order means anybody can go and she will be the doctor for it. The Commonwealth of Pennsylvania has since adopted this practice statewide and acknowledged Dr. Arkush's initiative to start the program here in Montgomery County. Welcome. Next we have Kay McGowan. Kay has been with the Montgomery County Office of Drug and Alcohol since 1983 and is currently administrator. The Montgomery County Office of Drug and Alcohol provides a wide range of services to Montgomery County residents falling in three main categories: prevention, intervention, and treatment. The office is committed to treating addiction as a chronic disease requiring long-term support and is guided by a philosophy that embraces hope, respect, and support for recovery. Kay has a master's in human organizational science from Villanova University and a bachelor's in social work from Kutztown University of Pennsylvania. Welcome, Kay. Next we have Michael Beatty. He's the Chief Deputy of Montgomery County Sheriff's Office. In this role, he's responsible for all the deputy sheriffs. Prior to joining the Sheriff's Office, Michael has served the department for 30 years in the White Marsh Township Police Department, including Chief of Police since early 2011. Among many roles in the White Marsh Township Police Department, Michael was a member of the Pennsylvania Attorney General's Montgomery County Drug Task Force, and he was coordinator of the Bureau of Narcotics Investigation Drug Task Force. Michael is a graduate from Northwestern University School of Police Staff and Command and from the FBI National Academy. He holds a bachelor's degree in business management from Temple University. Welcome, Michael. Next, we have Mr. Gary Billings, who was a counselor at the Salvation Army's ARC, which is the Adult Rehabilitation Center. He admitted himself to the Salvation Army's ARC in May of 2009 and graduated in May of 2008 and graduated in March 2009. Gary became their intake coordinator in August 2011. He was promoted to counselor in January 2013 and received a certificate in alcohol and drug counseling from Villanova's Continuing Studies program in April 2013. Most recently, in September 2016, Gary was promoted to warehouse truck supervisor. Welcome, Gary. And finally, I'd like to introduce and thank Benny for joining us this evening. Benny is an advocate and local survivor. He currently works with the Malvern Institute Recovery Centers, a private addiction treatment center. I have read a number of powerful interviews with Benny, but instead of me talking about them, let me turn it over to Benny to tell his story in his own words. Here you go.
Thank you. I'm Benny. I'm a recovering addict. I'm very grateful to be here tonight. This is an epidemic that we're going through right now, and I was one of the ones that was fortunate enough to survive. I had a lot of different chances to get this thing, to find recovery, but it took me over 10 years of coming to meetings and going to rehabs and things like that before I finally stayed clean. And it was because I never thought that heroin could happen to me. A lot of people told me that if I kept doing what I was doing, that it was going to get that bad, that I would get that bad. But when you feel young and invincible, you just don't think you're going to get there. I grew up locally. I'm from Conshohocken. I played football for the Country Bears. Went to Plymouth White Marsh, played football. And then drugs came into the picture. And when I first started to get high, I was one of those guys that was instantly hooked. And it started out innocent enough, like even when I was smoking marijuana, my parents thought it was a phase. But pharmaceutical pills were readily available. They're around. Doctors don't hesitate to give them out. I remember I had a lower back injury, I think it was my freshman year, from playing football, and I must have killed that bottle in 2 days, and I didn't know anything about opiates or pills or anything like that. I just knew that I liked the way that they made me feel. And as time went on, I never learned how to be an adult. I never learned any coping skills. I just continued to get high and waste my life away. And in those times that I would come into recovery and put a little bit of time together, maybe I'd get some good things or I'd meet some good people. I went through 2 marriages because I didn't have a relationship with myself because I was too worried about getting high. I had 2 children. I have 3 now. But by the end of my using drugs, it turned from pills to heroin, and I was a 35-year-old man sticking a needle in my arm every day, and I swore that it couldn't happen to me. And as of March 27th, 2012, I never touched another drug. And it was because I had enough, and I was fortunate enough. I walked into Eagleville Hospital. I didn't have insurance. The doors were open. I told them I needed help, and they helped me. Now, unfortunately, I go to a meeting at Eagleville Hospital on Sunday nights at 8:30. They have a guard at the entrance now, and you can't get into the property even without a referral. And this epidemic is worse than it ever was. And before, I could walk in there and get help when I needed it. And now you can't get past the guard to even talk to them about getting help. I find that to be a little ironic. I was fortunate enough that these people, and I was there a few times, never turned me away. I always knew I had somewhere I could go and get help. And from there, I got involved in the 12-step process. I'm a member of a 12-step program, and it's done nothing short of save my life. For me, I'm someone that believes in complete abstinence. I can't take anything mind or mood altering and change. And that's what I needed to do. If I was the same person I was when I came in and got clean almost 5 years ago, I wouldn't have stayed. I had no relationship with myself. I didn't know how to work. I didn't know how to live. I didn't have the basic living skills that other people have because I was too consumed. I needed opiates like other people needed oxygen. It's a disease, not a moral deficiency. And I really had to learn and accept that when I was treated like a criminal or I was treated like a scumbag because I couldn't stop using drugs. That's not the way to go. Like, I was a sick person. And fortunately, I got the help that I needed. And it was through being involved in a 12-step program and really being willing to do anything it took to stay clean that I got where I'm at today. And, I'm fortunate enough, I do work in this field. I see Malvern Institute on my card, and I didn't know it was going to be like that. It doesn't matter where I work or what I do. It's a labor of love to me. I get to give back what was given to me. I can never repay all the help that I was given from all the countless people in this process. When you're in recovery, and it's from one of the literatures, you're like the survivors of a shipwreck. You might be completely different people. You might not be somebody that you get along with on the street, but you're all in it together and everybody's in it to survive. And I've gotten help from some of the most unexpected places. But there's a tragic side to it too. I've seen more people die from overdoses in the last year and a half than I've seen in the whole 15 years that I was coming around. I've seen parents lose children. I've lost friends. Patients. 19-year-old girl not too long ago, her and her 22-year-old boyfriend decided, they had enough of the recovery scene. They found them both dead together. You think you could do one more, and with the way that they're putting fentanyl and things like that and the heroin today, it's not like it used to be. People are dying. And without the proper treatment in place, and I think long-term treatment is necessary for some people, it's never going to change. And as long as we're treating it like a moral deficiency and not a disease, it's never going to change. I mean, don't get me wrong, you can love somebody to death. I had to lose all contact with my family. I had to lose all contact with my children. I had to lose everything I cared about to be willing to do anything to change my life. But when you reach a state of willingness, if the help is available, which is key, if I can recover, anybody can recover. And like I said, I'm just very, very grateful to be here tonight and be a part of this. That's all I have. Thanks.